Hello and welcome to the Non-Perfect Parents Club podcast. I'm Emma, a mama of two girls, an ex-nursery practitioner and the creator of the Non-Perfect Parents Club. The Non-Perfect Parents Club is all about support, honesty, truths, acknowledging that none of us can be perfect parents because it's impossible, and basically just speaking the unspoken. The only rule here is no judgment allowed. I love hearing people's stories. I love finding out about other parents, their family dynamics, their values and how they tick. So that is what this podcast is going to be. Some great honest conversations about parenting, hopefully delving into some nitty-gritty thoughts and feelings that will make us all laugh, cry and sigh a big sigh of relief. This episode is sponsored by Stingray's Swim School from 315 Health Club in Lancaster.
Places are available for swimming with Stingray's Swim School at 315 Health Club in Lancaster now. With group lessons suitable for babies from 9 weeks old through to school starts and older too. And with flexible ways to pay. Your child can develop their water confidence and learn to swim whilst having a splashing good time. Find out more. Call 237 315. Drop into 315 Caton Road, Lancaster. Or message the Stingray's 315 Swim School via Facebook.
Hello and welcome back to the Non-Perfect Parents Club podcast. Today I am joined by Dr Katy Hill, a clinical psychologist specialising in parental stress and burnout. If you follow me on Instagram, you will have seen some of Katy's posts already shared on my stories from her page, The Parental Stress Psychologist. Hi Katy, thank you for joining me. Would you like to introduce yourself and tell us a little bit more about what you do?
Yeah, sure. Thank you for having me on, Emma. I'm delighted to be here. I think this podcast is brilliant. It's right up my street, the idea of non-perfection and reducing pressure in parenthood. So I'm Dr Katy Hill. I'm a clinical psychologist and I specialise in parental mental health, but I have a particular interest in parental stress and burnout. I'm also a mom, so I have 3 children and my eldest is almost 12. I have a just turned 9-year-old and a 5.5-year-old. And so there's this kind of this phrase, this kind of joke in academia about research is me search, and that is definitely why I'm into this, because I found parenthood so stressful and so different from what I was imagining. I thought I was going to walk in, like I was a psychologist for a long time before I became a parent. I'm going to be the best parent ever. I thought I have so much information and I have so many skills and da-da-da. And wow, when it happens, it can really blindside you. So yeah, that's my passion. And I'm really glad to be here to talk about it today.
So what I love about what I see from you on Instagram is that you're real. And I think for so long we've had professionals telling us what we should be doing, but not applying that to real life situations and acknowledging that one size doesn't fit all. So tell us, what is burnout?
Right. So, and I feel that that's still happening on Instagram as well. I just, as a bit of a detour, I don't have personal social media. I never have. I've never been into that. I started my Instagram page about a year ago when I opened my private practice, because I thought that would be a really good place to kind of meet parents that were feeling quite stressed out and kind of put some different information out there. And the minute I joined, my God, the stuff the algorithm shows me, this kind of ever-loving stream of perfectionism parenting, and quite it can be quite frightening, some of the messages about how you might be messing your children up, traumatizing your children, and the pressure on that app is crazy. So that's why I'm on that app. And I think there's still an awful lot of that on there about very simplistic, no nuance kind of messages about how to get it right. And that is linked to burnout. So burnout is a chronic exhaustion syndrome. And most people will be aware of it in the kind of occupational context. So you can be burnt out at work. People would understand that kind of idea of being really exhausted. And then you start to get detached from your work, quite cynical about the work. You're not enjoying it anymore. And it's just become a horrible grind. Well, that can happen in parenthood. And to me, it makes so much more sense that it would happen in parenthood, because parenting is work. And it's work that you were not trained for, that you do not get any kind of You don't get a lot of work colleagues, you don't get time off, you don't get sick leave, you can't quit this work. You know, when you get burnt out at work, you can speak to your manager, you can go on sick leave, you can speak to HR, you can look for other jobs, you can, you know, there's ways around it. It's still horrible. I'm not kind of diminishing work burnout, but there are ways out of it that there aren't in parenthood. So it happens more often. It doesn't happen more often, sorry. It is more understandable to me that it would happen in parenting. So parents who are burnt out get very exhausted. So emotional exhaustion or cognitive exhaustion, you can't think straight, or kind of just physically, you wake up in the morning and you just think of everything you've got to do and just think, oh my God, I can't even get out of bed. Like, I don't even know where to begin. And that kind of exhaustion gives way to a distancing with your children, an emotional distancing. So parents that become burnt out, they can't escape the parenting role. So they kind of psychologically escape. They start to kind of parent on autopilot. So they will go through the day doing the things they need to get done, taking the kids to school, making the lunches, getting them bath, putting them to bed. But that quality time, that love, that connection, that disintegrates. It's really sad. And because they're so exhausted and because it's become a grind and because they're so saturated and fed up with it, they've lost all the joy of parenting. It just becomes so aversive and horrible, and they feel a lot of shame. And that's one thing I try and do in my Instagram account, is try and remove some of that shame, because they really feel awful about it. One of the criteria of parental burnout that's really important is that it's a contrast to the parent that you used to be. I'm not talking about, I don't know, in quotations, bad parents or deadbeat dads or whatever, people that were never invested in their children. It's a huge contrast to the parent that you were. So very often there's like a burning in period before. The parents that get burnt out are the ones who care deeply, who work so hard to be a good parent, who love their children, who kind of overextend themselves. They've burnt out through trying so hard. They're not bad parents at all. Anyone listening to this is resonating with what I'm saying. You are not a bad parent at all. You are stressed out.
I can relate to that myself, as I'm sure many of the listeners will be able to as well. So how normal is it for parents to feel burnout?
Very normal, very normal. Unfortunately, very normal. It's something that we never really spoke about before. It wasn't a research topic. And I have ideas about why that is, because I don't think that we take parental mental health very seriously, and especially it's more common in women, and I don't think we take women's mental health very seriously. So there hasn't been funding there. But in around 2017, the research started to really take off, and it took off massively in the pandemic. I think lots of people listening, if they were parents during the pandemic, they will, even if they've never been really burnt out, they will resonate with this idea of burnout, because the pandemic was, oh my gosh, I'm just like shaking thinking about what happened to us during that time. That was an intense time. So the research that we have now suggests that there's about, on average across the world, 5% of parents are burnt out at any one time. So that's quite a small number, 5%. But actually, if you think about 5%, that's 1 in 20. That's at least one parent in every class. So that's not uncommon. And it's different in different countries across the world, which is really interesting. And this really points to how it's not about the parent, it's about the situation that the parent's in. In some countries, burnout is unheard of, parental burnout. It's been studied, there's a great study of 42 different countries across the world. In some African countries, completely unheard of, even though there's people in those countries are living with, lots of deprivation, or they have like multiple children, and maybe they don't even have much support, but there's a different society there. Some countries have super high levels. So America is crazy. American kind of burnout as a whole is something like 10, 11, 12% of parents in America are burnt out because they do not have any support in that country. And the pressure on them is crazy. Western Europe is something like 5 to 8%, something like that. Now, during the pandemic, those rates absolutely shot up. And there are some surveys, it's not really quite scientific research, but surveys of parents asking them, have you ever been burnt out? Do you ever feel burnt out? Those surveys come up with about 80% of parents will say, yes, I am, or I have been burnt out. And in the pandemic, that was something like 85% of parents. because it's the situation that you find yourself in. It's not about you, it's about the situation.
Yeah, that's a really good point to acknowledge there as well. I think that it's the situation you're in, and it blows my mind, as stuff often does when we talk about parenting and motherhood, that it's not wider, it's not talked about as much, and we're not kind of made aware of these things at the start as we're going into parenting. I feel like if we were more equipped with topics like this, we would be able to acknowledge stuff much sooner or understand it much better, and it would make such a big difference.
Absolutely, I completely agree. I don't think we talk about mental health as a whole very well. We are much better. Like, I started in this career, like 25 years ago. And mental health then meant serious mental health, schizophrenia, and we had really horrible ideas about what schizophrenia was as well. And now I think it's much more mainstream, and we understand the nuances and how we can all have mental health difficulties. But when it comes to parenting, I think there's an extra layer of stigma that makes it even harder to speak about. It's really hard to say, especially as a mother, that you are struggling in parenthood, that you don't like your kid at the moment. That's a horrible thing to say out loud. It feels awful thing to say, but it's really common. I definitely had that thought. I've had that feeling, but I'm not going around telling people, oh my God, you don't talk about that on the school run. But we don't, do we? And it's so normal. And so much of the work that I do with clients very early on is trying to normalize these feelings and say, you are not a monster. They will come to me and it's got so bad that I'm the last resort, and they just think I'm the worst parent in the world. I'm a monster. You won't believe the things that I think. You won't believe, and I will, because I've thought them myself probably, and I think most parents have. Yeah. I would love it, like you say, if we had this education before we became parents, and I've looked into kind of running groups or doing something for kind of pregnant people to give them a bit of kind of mental health education of what you could expect and how things could go differently and And the feedback that I've had is that like, we're not in that mindset before we have a baby. People are very kind of what's the word, like very hyper focused on the birth. I remember that before I had my first child, like, what's the birth going to be like, and will I use hypnobirthing, and what, like, we get very focused on that. And the second thing is we get very focused on the equipment we need, like decorating the nursery and getting the right pram, and we think about the optics of it, the nice little baby growth and things like that. And if someone comes along and says, oh, do you know that you might have a traumatic birth, or you might get postnatal depression, because that's really common, and people don't really want to hear that. It's like, no, don't burst my bubble. That's not for me. And no one really thinks that that's going to happen to them either. We all kind of think, I don't know about you, but like, I definitely did. I thought I was going to be a great mom. I was going to be so patient and so loving and calm and so fun, and like, I wasn't going to have any problems. So I didn't need to know about anything like that, because I really wanted to be a mom. I was going to be great at it. So yeah, I would love to give people more information before they get here, but I think we're a bit naive before we have kids, and there's a lot of stigma about it as well, so it's tricky.
Yeah, that's a really good point as well, and we definitely do kind of focus on like the more physical aspect, don't we, like you say, the birth and the nursery and the things to buy and the clothes and yeah. So how do you know if it's burnout or if it's depression?
Right, so I get asked this quite a bit because there's a lot of overlap. So if we're thinking about somebody who's exhausted and irritable and low in mood, fed up, not feeling it, then that could be burnout or it could be depression. But the key thing that makes the most sense to me is depression is global. It happens across the whole of your life. So if you're depressed, then you're going to struggle at home, at work. You're not going to want to do your hobbies. It's hard to keep in touch with your friends. The programs that you like to watch on telly normally just don't do it for you. Like, it's awful depression. It's a whole global sense of doom and negativity and hopelessness. Whereas burnout is contextual. Burnout will happen in a context. So it could just be at work. But when you go home, you feel fine, you enjoy your kids' company. And maybe if you get signed off from work, you don't feel burnout anymore, you feel great. And if you have parental burnout, it's the opposite. So maybe you just feel it at home when you're with your kids, in your parenting role, but you like to go to work. Maybe it's an escape. I speak to lots of parents who, this is something parents feel guilty about as well, saying, I love being at work, it's a break. I don't like to go and pick them up from nursery at the end of the day. I'm always the last mum because it's just nice to get away. That's burnout, that's not depression. That's contextual, it's fixed to that context. There's other things as well, like, what causes it? So burnout is a stress condition. So it's caused by stress only. So too much stress, not enough resources to cope. Depression is multifactorial. So it could be you're stressed out so that you kind of fall into depression, but it could be that you've suffered a bereavement or a loss event. Maybe you've lost your job, or a relationship has broken down, or it could be a reaction to a traumatic event that can put people into depression. And biological things can affect it as well. Some people whose thyroid isn't working properly will kind of have depressive symptoms. So depression is more global. It's caused by lots of different things. Burnout happens in one context and it's caused by stress.
And another thing that I kind of wanted to touch on was this, again, tends to be on Instagram, and it's this message going around of, when parents are feeling burnt out, or the whole, what should we do for self-care? And it's this thing of get a bubble bath, go and do the food shop on your own, that kind of stuff. Now, I know you've done quite a few posts on that. So I just wanted to touch on that and ask for your thoughts on that kind of thing.
Yeah. I've got so many thoughts. How can I organise my thoughts? Instagram just as a whole drives me crackers because it's so simplistic. Here's 3 tips to remove parent burnout from your life. Here's one: if you're not doing this one thing, your kid will never sleep through the night. And it's utter nonsense, but that's what the algorithm rewards. And I get frustrated about the content that I want to make. I want to put nuance in there and context, and it's not going to go anywhere. I have to kind of say, here's one big tip. But I sometimes, those posts when I say like a bubble bath won't help your parental burnout, sometimes, mostly they're well received. Every now and again, I'll get one kind of cranky comment. Someone who's not bothered reading it properly gets cross with me and says, oh, I like bubble baths. They make me feel good. And I like yoga. And what's wrong with scented candle? I love my candles. And I'm like, oh God, yeah, good. I'm not dissing candles and bubble baths. And if that works for you, grand. But I explain it in the caption. But people on the internet are always willing to willfully misunderstand you. You can have a bubble bath and it can make you feel really nice in that 10 minutes. If you like baths, I can't stand them, to be honest. Lying in my own filth is just really boring and doesn't do it for me. But if you like that, grand. That will make you feel good that evening. But it's not a cure for burnout, because I'm not talking about stress. I'm talking about burnout. If you're depressed, another way. If you like watching a specific kind of sitcom or something that makes you laugh, and you're having a bit of a bad day and you're feeling a bit unhappy and a bit down, a bit kind of like, ugh, and you watch that program, it's going to give you some temporary relief and you feel good, great. But if you're depressed, if you have clinical depression, watching that program is not going to help your depression. And that's the problem I have with quick tips for burnout. Burnout is serious. It's a serious condition. It's not as simple as that. And it's just, there's a whole kind of, it happens on Instagram as well, like a consumerist kind of idea to self-care, that if you buy this product, you buy this candle, you buy this bubble bath, you buy this course maybe sometimes, or buy my book, buy this solution to your problem. It's consumerism and it's simplistic, and it's another thing, it's kind of locating the problem in the person, and it's dismissive. Oh, you're stressed, you're tired, whatever, have a bubble bath, sort yourself out, stop moaning, crack on, go back, being more productive and more cheerful so we can enjoy you more, kind of thing. I think it's much more complicated than that. And burnout especially is very complicated, and burnout needs specific assessment and formulation and treatment. And it is never as simple as a bubble bath. And I find those posts they irritate me. I'm trying not to go on a rant. You know what I'm like? It is annoying to me that people are presenting these things so simplistically and so dismissively when people are suffering.
Yeah, I guess it's only adding to the problem of parents kind of thinking, well, I'm doing this and why it's meant to help me, but it's not helping. So is there something more wrong with me?
Exactly. So a lot of the parents that I see, not all, but a lot of them already come to me, high levels of shame, high levels of self-criticism, feeling that they're failing at the thing that's most important to them in the world, being a parent, loving their children. They feel that they're failing, and they have tried everything, a lot of them, before they come to see me. But before they've admitted to a psychologist that they're struggling in parenthood, that's such a brave, courageous thing to do. And it's the last thing that most people want to do. So they've tried it all. And I say, oh my God, I've downloaded the apps. I've got Headspace. I try to meditate. And oh my God, I hate that you think that you are failing and now you're failing at self-care as well.
So what are things then that we can do to help ourselves?
Right. So bearing in mind what I've said about 3 tips to reduce burnout or whatever is really useless. I'm always caught in 2 minds. I mean, people want me to give them like 3 tips or like, what do I do? And I want to give that. I want to say, here's the answer. And I know that I can't do that because specifically with burnout as well, every burnout story is different. Everyone that I meet comes to burnout through a different route. So the solutions for them, in inverted commas, are different from the next person, and so on. So burnout isn't the best way that I can explain burnout or how it happens is it's a kind of a balance between your stresses as a parent and the resources that you have available. When there's an imbalance, when there's more stress than resources, then that's where you start to get very stressed out and eventually you get burnt out. So the best tip I can give anyone is to learn what your balance is. And there's a great questionnaire online. I don't know if there's going to be show notes or whatever. If you go to my website, drkatyhill.com, I have all the stuff on there. There's a great website called, let me get it right way around, Parental.com. It's a French website, so they call it, I can't speak French, so I'm not going to try and pronounce it, but they say it the opposite way around to us. You can make that English on that website. You can click a button and it turns to English. They have a questionnaire on there called the Balance and Risks questionnaire. That doesn't sound right. It's called a BR2. It's about the balance of risks and resources. So you can answer all these questions and it will come out what your balance is like. And then you can get a more personalized answer, because one person needs childcare and rest and a break and maybe some more information about child development. Another person has a partner who's not helping them enough, who's putting them down. They have a relationship that's very conflictual. Someone else has a child with a really complex medical condition that needs a lot of appointments and a lot of triaging and a lot of organizing. And so if someone else has 5 children and it's just so much, like there's so many different reasons people will come to burnout. So you need to know your own particular balance and risks. I have much more information on my website about this. I have a free kind of download ebook on there as well, which is kind of helpful for people to see about this balance. But I also have what I would say are like the 12 most kind of evidence-based stress relief strategies on there. And I kind of divide those up into biological, psychological, and social strategies, because stress is a mind-body problem, but it also happens in a social context. So this is another way to bubble bath is just nonsensical. It's not going to help. This is a really complex problem. So the biological strategies I have on there are things to help you come out of the stress response, to come out of fight or flight into rest and digest. So that's things like making sure you get enough sleep, that you're exercising, that you're hydrated, that you're eating properly and frequently, that you're breathing properly. One of the best things, if you want somebody wants a quick tip right now, one of the best things that we can do to get out of what we call the sympathetic nervous system or fight or flight into the parasympathetic nervous system, which is the rest and digest, the calming response, is to slow your breathing down. So anyone listening that's feeling kind of stressed, if you slow down your breathing so that your out breath is slower and longer than your in breath, and you slow down, that will start to help calm your body and your busy mind and bring it all down. So in this ebook, I have those biological strategies. The next part is psychological. So that's the bit that people come to see me about, really, is stress management skills. So a lot of people will manage stress in ways that make it worse long term. So they will scroll, or they will drink wine, or they will just try and avoid their problems, and I can teach them more healthy stress management strategies that will involve things like mindfulness, self-compassion. Emotional regulation skills are really important in stress and burnout as well. People come to see me for that. Perfectionism is huge. That's one of the most common things that we talk about in sessions. People don't come to me saying I'm a perfectionist. No one ever thinks they're a perfectionist. But we get that after a few sessions, and we realise this person's standards for their parenting are so high, and their fear of making mistakes is so high that actually they're a perfectionist, but they didn't realise. And it's so encouraged in our society, perfectionism as well, especially in parenthood. So yeah, people pleasing, not looking after yourself, looking after everyone else is another psychological strategy, is something that we work on. And any kind of mental health problem like trauma is a big one as well. People will come to me and say, I didn't think that my childhood was traumatic per se or difficult. I wasn't sure. And then when I became a parent, all this stuff got dredged up. All this kind of difficult relational stuff between me and my parents and my caregivers, or me at school, or me when I was bullied, all this stuff has resurfaced. Parenthood has such a knack of bringing this stuff up from the past that you either buried or didn't realise was important. So that's a lot of psychological stuff that could be helpful. The third thing is then social strategies, and this is so key. And this is why I love when you're talking on Instagram about having parent support groups and meetups and things like that, because that is so important. And we're told all the time that we're supposed to parent in a village, and it's really annoying because there isn't a bloody village. But it's true. We're never supposed to be parenting in the way that we do. It's absolutely maddening. Like, you think how humans evolved, and we're supposed to be in these tribes, and it's supposed to be like me with my kids and you with yours, and maybe our sisters and our cousins and our friends, and we're all doing it together, and someone's keeping half an eye on the kids, but the kids are all kind of entertaining themselves in their mixed age groups, and other people are hunting and gathering and all the rest of it, whatever. We're supposed to do it together. We're not supposed to be on a housing estate, one woman with two little children slowly going out of her mind, and everyone in their street is another woman in a house on her own doing, like, it's crazy how we try to parent. You need social support. You need practical support for caring for children, because especially little ones, that's a lot of work, but you need emotional support. And being with other people is not just about support because things are bad, but about the positive sides of that, like just feeling like a person and an adult in your own right, and having fun and having a chat with someone and talking about things that aren't parenthood, and having hobbies and having a fuller life than just being a parent. A lot of the parents that come to me, life has got so narrow and has got so focused on parenting, and they've lost a lot of their identity and a lot of what makes them tick as a person outside of being a parent. So we work on things like that. So yeah, social stuff is really important. And in that, I also want to add, like, within your family as well. So being able to have more of an idea of child development and what's appropriate for children of different ages gives you more kind of more realistic expectations of what your kids should be able to do. And having a better relationship with your co-parent is really important as well. And being able to not just like do things kind of equally, but share it fairly, and to be a couple, if you're still together as well, to be a couple first and foremost. That's really important. There's some really interesting research that came out recently. This researcher looked at whether being a single parent was more stressful and more related to burnout. And it is. It's much harder to be a single parent. But what they found was the parents who had a co-parent who was not supportive, who was maybe even undermining them, who had a really difficult relationship with their co-parent, they were less happy than the single parents. They were more burnt out than the single parents. It's not good enough to have people with you or a partner. It's about the actual support that you're getting. So yeah, that's a really long-winded way of answering your question. Like, what can we do? it's really complicated. And I'm such a psychologist. I know that psychologists really irritate people, especially medics. I used to work in a hospital. I used to work in heart and lung transplant, and we drive medics mad because they want an answer. They want to know, how do I fix this person's anxiety, or how do I get this person to come for an operation, whatever it is. And psychologists will go, well, it depends. It drives them crackers. They want the answer, but it depends. There's so much complexity in mental health. So yeah, I can't ever give a straightforward answer, I'm afraid. But there's loads of resources on my website. So if this is resonating with anyone, like, go and have a look on there, and you can be able to find more information there.
Yeah, and there's so much there. There's a few things that I want to touch on from what you've just said, but I will add your website into the podcast description. So if anyone wants to find that, it will be in the podcast description. Going off what you've said, that there's no like one size fits all, we're all different, and that's why it's important not to minimize what people say. You know, like you say, you've got a friend or someone you know, and they're trying to offload to you and tell you how they're feeling, or maybe even a family member, and so often you can find that other people will minimize what you're trying to say, and I think it's not done maliciously. It's often done because they're trying to problem solve it rather than just listening. They're trying to help, but there's so often where there's like comments said and kind of minimize what you're trying to say, and I think that's why it's so important. Sometimes we've got to remember also that we need to just listen and kind of acknowledge and empathize, and I'll come back to things that people say after this, but I just wanted to ask as well, you mentioned about getting enough sleep. What would you say to a parent whose child doesn't sleep and therefore they don't get enough sleep? How would you what would you advise in that situation? Because I know some of the listeners, or a lot of parents, they hear that word sleep and it's like instantly like a trigger, like, my child doesn't sleep, what am I meant to do?
Oh, I know. I had my first child did not sleep. She oh my goodness, I'm getting flashbacks just thinking about it. She's nearly 12 now, and she still doesn't sleep well. Like, some of us are just wired up that we don't sleep well. That I'm a bit like that as well, just kind of like my vibrations are quite high and it takes a lot to calm down. And and I've got two other kids that just slept well from when they were born. So much of this is genetic, and I don't want to go on a massive tangent as well, but that is a huge pressure reliever for parents as well. When you look into the research and realize how much of who your child is and how things will unfold is genetic and is not something that you can control. We kind of believe, I think a lot of us, I certainly did, coming into parenthood, that we can, we'd like a child to be a certain way, certain personality, a bit like us, a bit more successful in the things that we want you to be at, have the same interests, and they come out as they come out. And we have a really strong influence through attachment. We're really important, but we're not the only influence, and we cannot make our kids be who they aren't. And you can't make a kid sleep. There's lots of things that you can do to support sleep, but yeah, I've learned the hard way, you can't force sleep, unfortunately. And yeah, when I said before sleep, I can feel my eye twitch when I say the word sleep, because I think, oh yes, just sleep when the baby sleeps, that kind of advice. It's really aggravating. So I want to be really careful if there's someone listening now who's sleep deprived and getting irritated with me, that I'm going to provide some kind of straightforward answer, because I can't. The things that will help, again, I'm such a psychologist saying it depends, but it does, it depends. It depends. Your child might not sleep well because they have a medical condition that needs to be investigated, or because they haven't learned to self-soothe and you need some help with some kind of sleep coaching or something like that. Or maybe it can't be changed and you need to find help from a co-parent or someone who can take shifts with you, ways that you can catch up in sleep during the day. Or the answer for each parent will be different, I'm afraid. But I do really sympathise with that that feeling that you can't get this kid to sleep and you're absolutely bloody exhausted. And I think when you're in that state, one thing that's really important is to just really lower your expectations on yourself and really be kind to yourself and really just slow things down. Because when we're tired, when we're sleep deprived especially, that hormonal state that we're in makes us so reactive, and it makes us really shouty and really angry and irritable, and it affects our appetite and our motivation and everything. It makes everything harder when we're sleep deprived. So parenting is hard, and parenting while sleep deprived is double hard, like super hard. So just take the kind of your expectations on what you can achieve in a day and what kind of a parent you can be, bring them right down and be kind to yourself. And again, look for some support, whether that's sleep support or helping you get some extra rest in some way. But there isn't an easy answer, I'm afraid, and it's really hard. I really feel for anyone in that situation.
Yeah, and I think it's like you say, it's just, I guess, being kind to yourself as well. I know of so many parents, and I've done it myself in the past as well, many times, where you're tired, but you feel like you've just got to keep going, and you keep pushing yourself. And like, for me as a child, like, you didn't rest, you know, I say child, I mean, like, you know, obviously teen and getting older into like adult age, it was like you didn't rest, you kept going. So that I was kind of conditioned to be like that. And it's only very recently that I've learned that it's okay to stop, and it's okay to not, I don't know, whatever job needs doing or whatever thing needs getting from the shops or whatever, that it's okay to not push myself to get it all done. And if I need to rest, then it's important to take that time and rest.
Yeah, I think loads of people will resonate with that, women especially, but all of us. And this is another reason why I think parental burnout rates are so high in Western countries compared to countries in Africa or the Far East. We have a very individualistic culture. We have a hyper capitalist culture where your worth is based in your productivity. We're socialized. We've all been, I mean, I'm 43 now. I've been socialized for the last 43 years to believe that my worth is in my productivity, how useful I am to other people, how busy I am. And rest is for the wicked. I mean, that phrase, rest is for the wicked. The devil makes work for idle hands. It's not just capitalism. This is back hundreds of years of equating busyness with virtue. So it's no wonder we struggle with rest. And quite often as a parent, there just are a million bloody things that need to be done, and all the school WhatsApps are going off, and you've got the book bags, and you've got work as well. And like, there are a million one things to do. It's not in your head. It's not just because you're like too productive or you won't rest or whatever. There are a million things to do. But yeah, we have been socialized for hundreds of years to believe that rest is for the wicked. So it is a hard thing to unpack.
And then I just want to go back, and I know you've kind of posted about this a little bit, and just kind of acknowledge things that people say that aren't helpful. I know sometimes, like, it's easy to kind of hear what people say and take that on board and kind of let them maybe silence you, or, you know, however that makes you feel. So I hope some of those things, it kind of might highlight them to any listeners, and next time they hear them, instead of feeling that awful feeling, they'll think, oh wait, hang on a minute, that's one of those things and I don't need to listen to that.
There's so many of these, aren't there? Yeah, whenever I post something like that, I get lots of responses from people saying, oh my gosh, this person said that to me. I've got a friend in New York as well. She's amazing. She's called Christine Carrick, if she's listening. She is a Montessori nursery owner. She's a mum of 4, and she writes beautifully about the pressure of parenthood. And she had this wonderful art exhibition up recently where she asked people that follow her, she's on Substack if you want to follow her, to write in unhelpful things, comments, judgments, things that people have said to you. And she made this art installation where she put it up on the wall, all these comments next to a toilet. Where all these things need to go in the toilet. People love to give unsolicited advice. I've had it from strangers. I've had it from a woman in Tesco when I had a first baby who had, she was just taking her first step. She wasn't walking. It was summer. We were just popping in to pick something up, and she didn't have shoes and socks on, and I was carrying her. And this woman came up to the baby and started talking to her rather than me, and started saying, oh, did your mummy and daddy not buy you shoes and socks? Oh, you must be so cold. Oh, you poor baby. Like, just really unhelpful. And I was really hurt by it. And it's funny now, but at the time, as a first time mom, that stung. I was so hell-bent on being a brilliant mom, and this stranger has seen to the core of me that I'm a bad mom, and she's seen it, and just really careless things like that. But it's not always strangers, it's people that are close to us. Like, they can say the worst thing. Just you wait until I have that one from people that are close to me. Oh, you think this is hard? Wait until they start school. Wait until they're a teenager. Wait until they're out at night and da-da-da-da. And sometimes it's supposed to be funny. I don't know. Sometimes it's, I don't know. It's always about the other person, isn't it? It's always a projection of their discomfort with your situation. It brings up emotions and difficulties and memories and whatever in them, and they don't think before they speak. I think it takes time to kind of grow into your confidence as a parent. So those things sting more when you're new at it. I'm a bit more of an old hat now, so I see this kind of thing and I can just brush it off. But at first it really hurt. I don't really tend to say things when people say stuff like that. I just ignore it. My husband's a funny one. He will say things like, oh, I'm sure you didn't mean to be so rude. That will really like throw people because they're not expecting it. But yeah, it's down to the individual. Just try and brush it off. Try and see it for what it is. It's trickier to do that if that's someone close to you. So if that's maybe your parent, sometimes our parents say the most cutting things and offer a lot of unsolicited advice, because the way that we parent now as a generation is very different to the way that they parented. And that can feel like quite a challenge. And it can feel like, to some grandparents, that can feel like a challenge on what they did. And they're still sensitive about their parenting. We all are. And they can feel like you're judging them. So sometimes these comments are kind of a protective thing, a projection or a protective thing for them. It's not easy. It's not easy to let these things go. But yeah, try, if you can, to surround yourself with people that don't say those things and give yourself a bit of space. You know who those people are. Give them a bit of space. It's not just you they're saying it to either. It's everyone. They're the common denominator. They're the ones that are putting it out there. You don't need to engage with it.
Yeah, so what I'm taking kind of from that is for us all to remember that it's not an us problem, it's a them problem.
Yeah. Always when someone says something cutting like that or insensitive, or it's coming from their own stuff, and it takes practice, but you don't have to take that stuff on. And it might be that it's really wounding you because it touches a nerve and there's something actually there that you want to think about, that maybe they've got a point in some way, or it hurts because there's a kernel of truth, or I don't know, maybe it's tricky just because of the rest of the dynamics around it in that relationship, things that are going on. And it might be that you want to speak to a professional about difficulties in your interpersonal relationships and family relationships. It might be something that you want to think about more, but most times it's something you can just kind of brush off and forget. I'd just like to add that anyone that's listening that's resonated with anything that I've said, I want you to know that if you've listened this far as well, you're a really good parent. You're a really good parent. You don't need to doubt that, and know that parenting is really hard. And it's a long game. It's a marathon, not a sprint. And your bad moments in the day or in the week or whatever do not add up to the totality of your parenthood or your children's childhood or anything like that. Pace yourself. Be kind with yourself. Get the support that you need. Take the pressure off yourself. Lower your expectations of what you can achieve. Try to enjoy your children rather than perfect parenthood or whatever it might be, and just be really, really kind to yourself, because so much of us are struggling with self-criticism and perfectionism and trying to get it all right. And yeah, you know what, that would be a tip that I would give anyone listening, is to unfollow anyone on Instagram, particularly social media in general, that makes you feel more stressed out as a parent. I speak to lots of parents who come to me because they've met me on Instagram, they've seen me on Instagram, and they follow every expert going, and they're overloaded with the right thing to do and all the tips and hints, and they're constantly going through parenthood as if it's an exam to pass, and they've got to get it right, and everything is so crucial, and the pressure that they put on themselves is immense. So I want to leave people with the sense that you're a brilliant parent, probably just a bit too hard on yourself, and you need more support.
If you've enjoyed this podcast, please don't forget to follow, share with other parents you know, and if you haven't already, please leave a review on the app that you're listening on. A new episode is released every Monday. Follow or subscribe to be notified when each new episode goes live. If you would like to be a guest on the podcast, please get in touch via any of my social media channels, website or email. Thank you to our guests for joining me on today's episode. It's been great to have you, and thank you to everyone for listening.